Margaret Colbong is a highly respected elder within the Noongar community. One of Margaret's greatest achievements is the establishment of the first Aboriginal medical centre in Geraldton in 1980. Margaret has dedicated a large portion of her life in addressing and solving problems faced by Aboriginal communities. She has been awarded an honorary doctorate from university, and our story explores Margaret's life and the events leading up to the award.
My name is Margaret Colbong. I'm an elder from the Whadjuk clan group of the Noongar Nation. This is my totem, the Coolbardi, and I welcome you to my land. Kaya, Wanju. My father, he was an itinerant worker and he worked from farm to farm, and we went from farm to farm, living in tents and living under trees and living in camps. And I enjoyed those years. The bush was my playground. I loved out in the bush climbing the trees, hiding in the bush, looking for berries, looking for the bush tucker and things like that. Because I come from a big Aboriginal family, a big Noongar family, and we shared and cared for each other. And then I just thought, well, this is what I've been doing all my life, was sharing and caring for my people and my sisters and brothers. And so I just took up nursing. The biggest challenge was the mainstream services and operation who weren't prepared to make changes to the way they delivered a service. The health and well-being of the Aboriginal people was deteriorating, and they didn't have appropriate services to care for them, to care for their health and well-being. They didn't know how to. And when Aboriginal people were talking about where their aches and pains were, they didn't know, or they couldn't understand what they were saying. So I thought, well, there has to be another way, because they're not delivering a service to my people, and my people were dying, and they had health conditions that could have been dealt with. So I set about setting up processes and programs for mainstream services and operations, and they weren't squandering the money that was allocated for Aboriginal people. I set about with a couple of other Aboriginal health workers in establishing a process for delivering a service, an appropriate service to the Aboriginal people, not foregoing the clinical or the medical side of the service, but the way it was delivered to the people and how it was delivered. It was understanding Aboriginal law and Aboriginal culture, and then delivering it in an Aboriginal way. That was the main part of that whole process of delivery. It was all about interpretation, translation and implementation of Aboriginal way of doing things, which is called Wongi Mai Barda, doing it our way.
My name is Margaret O'Connell, and I work at Curtin University in the School of OT, Social Work and Speech Pathology. And I work as a research fellow on the Moving Forward Aboriginal Mental Health project, alongside elders such as Auntie Margaret Colbong.
My name is Michael Wright. I currently work at Curtin University in the School of OT, Social Work and Speech, and I'm the research fellow also. I've known Auntie Margaret for a number of years, and over those many years that I've known her, her work in the community has been both tireless and at a level that's you can only consider as extraordinary. I mean, she's been in many ways devoted her whole life to improving the lives of Aboriginal people across the whole state and even across Australia.
Auntie Margaret has quite a story. She's got a huge amount of wisdom and life experience, and having heard many of those stories that she's graciously shared through the work that we've done with her and other elders, we thought that it was really fitting to honour the work that she's done in a small way, we think, by looking at putting in the nomination for the honorary doctorate.
I think she's absolutely, truly a worthy recipient, and I feel quite honoured to be able to do it.
Well, it was a big shock to me, because all my life, all I ever did was if things needed to be done and it was for the benefit of my people, I just went and did it. And then I think there were some people who thought, well, it was more than that. It was commitment and dedication to Aboriginal health and well-being and Aboriginal ways of doing things. So I thought, well, it was a shock. It was a shock.